Good morning, guys. What are causes of irrational talk in a bones patient? So, irrational talk in a bones patient have numerous causes. The multiple causes could range from central nervous system causes or metabolic response, and these causes could be medical, it could be psychological. So one is hypoxia. Hypoxia, which arises due to low oxygen supply to the brain, could cause confusion, agitation, disorientation, or delirium in a bones patient. And these are common in patients who had inhalational component or carbon monoxide poisoning following burns. These patients are likely to have irrational talks, confusion, and agitation, just like I said. Number 2 is electrolyte derangement. Electrolyte derangement like hyponatremia, hypernatremia, that's reduced sodium, increased potassium, or reduced potassium, or reduced calcium can cause confusion, it can cause agitation, it can cause seizures in a bones patient. Also, hypovolemia, a patient who had shock is believed to have lost so much water or fluid from the body. So if this fluid is not replaced, there's hypoperfusion to the brain, and this will cause the patient to have restlessness, confusion, and irrational talk. Also, sepsis, infection. Infection is a common cause of irrational talk in a bones patient. Infection from bone wound sepsis, infection from systemic response, that bone wound sepsis that leads to systemic response to trauma, then cause encephalopathy in a bones patient. This will cause fever, altered consciousness, and irrational behavior in a bones patient. We also have hyperpyrexia, that is fever, very high fever from infection and from dehydration can cause delirium and confusion in a bones patient. Then we have metabolic disturbances. Metabolic disturbances like hypoglycemia. Bones patients are believed to have hypoglycemia, and this hypoglycemia can cause irrational talk in them. Also, uremia and hepatic dysfunctions can cause irrational talk and make them talk abnormally. Then we also have metabolic related causes, opioids, drugs like morphine, pethidine that are given to bones patients for pain relief. These drugs can cause patients to behave irrationally. And also benzodiazepines, ketamines that are given when patients are on dressings, or when patients wants to have change of dressings, patients are constantly on them. This can cause irrational talk. Even sedation, benzodiazepines that cause sedations, this can cause irrational talk. And some antibiotics, imipenem and some other antibiotics can cause irrational talks in this patient. Then sleep deprivation and pain from the bones and sleep deprivation are known causes of irrational behavior, irrational talk in a bones patient. Then the situation at hand, which is the acute bones. The acute bones can cause acute stress reaction in a bones patient, and this can make this patient to have irrational talk. And morbidity such as intracranial pathology can cause irrational talk, such as stroke, cerebral edema, hypoxia, ischemic injury secondary to the shock or from the bones pathophysiology can actually cause irrational talk in a bones patient. Thank you very much.